Hi, this is Eric Hammer, registered physiotherapist, and I'm here speaking with Drew Costello, who's a registered massage therapist. And today we're going to be talking about sort of the impact that prolonged sitting, and especially with COVID right now, the amount of sitting that people are doing, and the impact that that can have on different conditions we're seeing in the neck. And so, again, from a postural standpoint, this increase in sitting can certainly can cause more tension, more discomfort in through the neck area. And today we want to talk about some of the common conditions we're seeing, some practical things that we can do to try and alleviate pain and discomfort, and then where physio and where massage can be helpful in terms of reducing pain, tension, and discomfort. And so, Drew, just from your standpoint, with some of the patients you've been seeing, have you noticed any differences in terms of the neck region specifically during COVID, and with the amount of sitting that people are now doing from working at home?
I think that people are getting better working stations now than they were at the start of COVID. So initially, I was seeing people that were sitting on a couch for 8 hours a day and who were, paying the price, not just with their neck, but everywhere for that. And also and just sort of the not being able to get up and walk around their office, not commuting, just staying at home and sitting in front of or sitting on the couch or not a great workstation. So I think it's better now. I think that people are getting used to being at home and they're just trying to have better workstations. And so offhand, I'm used to sort of seeing people who are working at desk jobs with upper back and neck issues. Now it's similar things, but it's just that added lack of movement throughout the day that they're noticing more.
Yeah, absolutely. And would there be? I'm just curious. Would there be, specific areas with sitting, let's say, in the neck area that you would notice more tension? Like, are there certain muscles or certain areas specifically when somebody's complaining about neck tension, so to speak, that you would really focus in on, or that you would notice tends to be tighter, let's say, for people, or hold more tension?
Some people are feeling it in the back of the neck, the base of the neck, base of the skull. Some people are feeling it further down their back, just from sitting positions. But I will look at people's posture and also inquire about their activity level. And again, workstations, like if things are, they're turned to the right or they're turned to the left, they're looking up, they're looking down, and just getting a whole story on what their working day looks like and if they're getting enough activity in throughout that working day. So the muscles that I'm seeing that are tight are the pecs, the upper traps, supraspinatus, top of the shoulder, and then sometimes a little bit further down in mid back as well.
Yeah, absolutely. And I can certainly kind of recognize that as well, like those specific areas, getting tight, and then some of the conditions that can lead to problems along that area. Again, when we're doing prolonged sitting, so I'm noticing, as you said, sort of right at the base of the skull. So suboccipitals. I've been noticing, I would say, a little bit of an increase in terms of tension headaches as well. So when as that muscle as it gets tighter, as people are in these sort of prolonged sitting positions and forward head posture type positions, that seems to be tightening up quite a bit. And I've been having people complain a lot more, just from a referral standpoint, about sort of tension in through the front of the head. And again, with that prolonged sitting, that can certainly be an area that people can complain about.
Yeah.
I've also noticed a lot more tension sort of upper traps, or kind of the CT junction area, so where the neck and the mid back meet. I've had a few patients recently where they've been complaining about disc-like symptoms. And so what I mean by that would be if there's any sort of, if we're in a prolonged, let's say, flexed position or looking down for long periods of time, there can be an increase in the vulnerability of compressing either a nerve root or a peripheral nerve. So along with neck tension, people have also been complaining a lot about kind of referral down the arm, numbness, tingling, which would also come with, again, this sort of looking down and being in those prolonged positions. So Drew, I'm curious about, you mentioned posture, obviously with this being really important. What are some sort of general tips that you tend to give people, or what are some practical things that they can do right now in order to either reduce some of the pain or tension that they have, or try to prevent this from happening?
Mm. Well, along with the massages and the treatments, um, their level of coordination and experience with exercising, I will advise people to do things is I like to start with the core working out. So I'll get them, strengthening their core just so I think they can sit up better in general, and they're not slouched over and extending their sticking their head forward and putting strain on their neck and their upper back. But it will be stretching the appropriate areas that are affected. A lot of sort of opening up the chest, and whether that is just with their own body weight, the resistance for opening up your chest. You can do it in a seated position. I find it's more effective if they have no weights or have no resistance, to be doing it on the ground, because then they're fighting against a little bit more resistance there. And then just finding out what they have at home to work with and prescribing them exercises there. So if they have bands, you can really strengthen somebody between the shoulders and the back of the shoulders with bands and a little bit of creativity, as well as body weights exercises. I can't remember the name of the exercises when they're down on all fours and send out like the right arm and the left leg simultaneously to just strengthen everything on opposite sides through the back. And that, along with the treatments, because they are in front of a computer, I'm sure that the eye strain is putting a lot of strain more than usual. And that's contributing to the headaches and the tension and just the general anxiety. So it's a mix of treatments, finding out what kind of equipment they have at home, and then prescribing exercises based upon that are a lot of the times back oriented.
Yeah, absolutely. And I really like that the point you made around, during COVID right now, trying to basically having to be adaptable, right? So I think that's a great point you make, that, at this point, making sure that people can do things at home, and, whether it's a TheraBand or setting up a program that's maybe more body weight oriented. So I think that's a great point, that, right now it's really important to, sort of bias and get those muscles stronger that are really going to help in terms of supporting somebody's posture. And yeah, from a physio standpoint, like a lot of these conditions, a big component of it is actually doing the opposite of the sitting, right? So for example, if we look at, conditions in which maybe there's pressure on a nerve root, for example, that's causing these peripheral symptoms down the arm. Well, in a lot of cases, the treatment would revolve around doing the opposite position to actually take pressure off of a nerve root, right? Or for example, if there's significant tension in through the suboccipitals or upper traps, well, a lot of the treatment then is going to revolve around how do we bias on a consistent basis the opposite positions, so that we don't end up sitting for 2-3 hours at a time, and all those muscles, again, they'll start to tighten up and then provoke some of those symptoms. And from a physio standpoint, I think a big part of what I'm looking for is, what are some of the muscles or movement patterns that are affecting this particular condition, and then how can we strengthen or develop a specific exercise program to bring the body into more of a neutral position, to take pressure off, let's say a nerve root, as we talked about, and to improve just the biomechanics of how somebody is sitting or standing, again, their posture. And then from there, some of the muscles that are still tight, right, because of the habits that they've gotten into. And then that's a great opportunity for me to send, right, those patients to, let's say, massage, and get some of the deeper work done, right, like more of the hands-on approach, and the deeper soft tissue work that, Drew, you're an expert at, right? So kind of being able to really combine the two in terms of, strengthening the muscles that perhaps are weak and are contributing to the person naturally going into these poor postures, and then working on the flexibility of maybe those muscles are working too much or that are very tight. And then again, that can be both an exercise and sort of a more of a passive soft tissue approach. So I can really appreciate going those two ends, right, with both the exercise component and then having the hands-on treatment as well.
Yeah. Yeah.
So Drew, just as a sort of just as an ending point for our conversation, what would be just some, if we were to summarize for you, what would be some general tips, right, that you would give somebody who is concerned that, they're sitting a lot, maybe they're not necessarily in any specific pain or discomfort, but they're looking to avoid, some of the things that can happen, whether it's tension headaches, whether it's something with like nerve root compression, whether it's just general tightness and pain in through that mid back upper trap area. What would be, maybe as a summary, what would be a few tips that you would just generally give that particular individual?
I would say to keep once you've got the stretches and the exercises, and assuming you've got the equipment to do these kind of things, to set timers throughout the day, like every 90 minutes or so, to just make sure that you're doing something and getting out of that stuck position. And I think that's important because it just snowballs where you might be feeling off or unwell or whatever the term may be, and you don't know why, and you kind of keep powering through your work. And without that break of 2 minutes to just, like, okay, I've got to do my exercises now, go do them and get back to it. You can take that time to physically move your body, which is going to feel better, and mentally take a break from what you're doing. So maybe you can reflect or whatever it may be. So you're not so overwhelmed, because a lot of people aren't they're in the same environment throughout the day. So it's knowing the exercises to do, which can be very basic things, like so people will benefit from pretty, what we would determine as basic instruction, which is great for them, and then they can just build on that. So it's just doing it, keeping it consistent, and then getting more exercise. Like I said, just building upon that foundation.
Yeah, absolutely. I completely agree with that. I think like a big component is basically just getting out of the sitting position, right? Whether that's, just getting up, moving around, walking, and then I think having a program, an exercise program that does the opposite of what they're doing all day, right? As a preventative way. And I think that's really key. I think another thing that can be really helpful as well is actually breath work. And so the reason I say that is, I think a lot of times people, they're sitting on the computer for a long period of time. There's a tendency to do a lot of kind of chest breathing or holding a lot of tension up and through, again, the upper trap area. So one thing that I've been tending to recommend for people a lot is just taking that time to actually do some deep breathing, diaphragmatic breathing, bringing the breath down and reducing, the amount of tension, so to speak, that we hold into these positions. And also, just in terms of desk setup, like really utilizing proper ergonomics from the standpoint of, maybe is somebody using a lumbar roll, a rolled up towel for their desk? Is their seat set up okay? Are they slumping a lot? So that when they actually are working, they're in the ideal sort of posture. And then again, as you mentioned, timers and things like that, to get up and get out of those positions as frequently as possible. So,
Yep.
So Drew, I wanted to thank you for our little discussion here. I think we've been able to give some valuable tips and information for people, and I just wanted to mention too that if you're watching this and you're struggling with pain, perhaps you're having sort of persistent or chronic neck pain, and it's been getting consistently worse, or you're concerned about this, feel free to reach out to either myself or Drew. We're going to have our contact information below with regards to emails and phone numbers. And really, this isn't something that you have to continue to put up with, right? So if you're having pain, if you're having tension, especially during these times, it's really important for us to take care of our bodies at these times, and to as we're sitting for long periods of time, to try to do our best to reduce the impact that the prolonged sitting can have on our bodies. So anything you want to end with, Drew?
And we're still allowed to work. We are essential services. So
we are, absolutely. Yeah, thanks for adding that, Drew. We're still open. So
yeah. So our email, our websites will be attached somewhere to this. And I think that's about it for today, right, Eric?
Yeah, that's it. Thanks again, Drew, and thanks for watching.
All right. See you guys.
Take care.